Hello, today I will be explaining how the DSM and the ICD approaches to the identification and treatment of abnormal differ. Abnormality is a division of psychology that studies people who are abnormal or atypical compared to the members of a given society. The concept of abnormality is imprecise and difficult to define. A few abnormal disorders are schizophrenia, multiple personality disorder, and bipolar. To make a diagnosis of a mental disorder, a health professional will either use the DSM or an ICD. The DSM is used to diagnose psychiatric illness. The DSM is organised into 3 sections with 20 chapters that each address specific disorders from depression to schizophrenia. Whilst the DSM focuses on mental health classification, the ICD has a much wider scope and covers all diseases and health-related conditions. Both the DSM and ICD contain criteria for diagnosing autism. The 2 sets of criteria are very similar, with identical wording in parts, although the number and groupings of behaviour are different. Neither set are considered to be more valid than the other, so it really comes down to preference. The 5 different dimensions are clinical disorder, personality disorder, physical health, environmental factors, and global assessment of functioning. The reason for using these is to generate a specific diagnosis against each of the possible dimensions. The DSM is used mainly in the United States, whereas the ICD is more commonly used in Europe. Both diagnostic tools require at least 2 or more symptoms to be present for diagnosis. The DSM and ICD is only used by health professionals and not for self-diagnosis. The ICD only lists symptoms, whereas the DSM lists causes for disorders such as gender, age, and prognosis. In conclusion, the DSM and the ICD both discuss symptoms of psychiatric disorders, but do not talk about treatments. As said before, neither of the models are seen to be more correct or valid than the other, so it is simply down to the healthcare professional's preference.
Created using Powtoon.